Are you worried about having a vaginal tear while giving birth? You are not alone. Hi, I'm Dr. Jessica Babbage, board-certified physical therapist and medical advisor with FemHealth. Today, we are going to talk about what you can do to lessen your chances of a vaginal tear during birth. If you want to keep learning health information from experts, be sure to hit the like and subscribe button below. First, what is the perineum? The perineum is the diamond-shaped area of tissue between your thighs. It can be divided into two triangular portions by the line between the sit bones, known as your ischial tuberosities. The front portion is called the urogenital triangle and contains the vaginal and urethral outlets. The back portion is known as the angle triangle and contains the anal canal. The perineal body, known as the central tendon of the perineum, is the area between the vaginal and anal opening and is susceptible to tearing during birth. In fact, 9 out of 10 first-time moms or birthing folks and 85% of vaginal birth experience some degree of perineal tearing. In most cases, it's mild, but in about 8 to 10%, it can be more significant. Tears can be rated as first, second, third, or fourth degree. A first-degree tear is the least severe, and a fourth degree is the most severe. There are several things you can do to minimize the risk of perineal tearing. Although the research is mixed on whether or not these strategies help, I still encourage people to incorporate them into their birth plan as there are no negative effects. First, tissue hydration. Stay hydrated throughout your pregnancy. You can't get fluid to fully hydrate the tissue the day of your birth. It happens 24 to 48 hours before, so that saline IV won't help with tissue distensibility because there's not enough time. You can't get the tissue to stretch fast enough. Towards the end of pregnancy, hydration helps with tissue stretching. Second, perineal massage. Perineal massage is usually recommended at 34 weeks pregnant, performing 5 to 10 minutes 2 to 4 times a week. To perform this technique, you find a comfortable position either supported on your back or you can try standing with one leg on a stool. Gently push up on the perineum and move in all directions, feeling for areas of restriction. Next, you can gently insert your finger into about one knuckle into the vaginal canal, sweeping along the side to release areas of restrictions. If you're having a hard time doing this on yourself, a partner can help, or you can use a vaginal wand. Glute pulls also help to keep the tissue pliable. To perform, you can lie on your side or place your foot on a stool. Reach around or by the sit bone on the inside near the perineum, and with a scoop hand, gently sweep through the tissues and muscles, thinking about spreading your butt cheek. You can pull back and up or up and out to the side. Think about doing this 10 times on each side. Pelvic outlet and hip mobility. It can also be helpful to work on the mobility of your pelvis and hips in order to create space for the baby. Next, warm compresses. During birth, applying a warm compress to the perineum during and in between pushes in the second stage of labor can help keep the perineum from severely tearing. Also, birth positions. Researchers believe giving birth in an upright position can be beneficial as gravity assists in getting the baby out. If you are unable to be in a gravity-assisted position, side lying is another great option as it allows for your sacrum or the triangle bone in the back of your pelvis to be flexible and get out of the way. It is important to work with your birth provider to find a position that feels comfortable for your body. Lastly, breathing. The pelvic floor doesn't push your baby out. Your uterus does. The pelvic floor needs to be able to get out of the way. During birth, breathing can help relax your pelvic floor muscles and help your body to be calm. It can also be helpful to think of relaxing your forehead and your jaw, as well as pushing with an open throat or a low-level ah sound. A tensed jaw and throat can tighten your pelvic floor muscles. Thanks for watching. I hope you all found this helpful and interesting. If you want to keep learning health information from experts, be sure to hit the like and subscribe button below. The doctors at FemHealth are here for you and your family.